Well, hi everyone. This is Dr. Schroeder with this audio screenshot lecture on substance abuse disorders, and we're going to be picking up and covering the information that we did not actually cover in class. So I'm just going to be using my screenshot recorder here to go ahead and record this audio with video from my computer screen. So going through, I have removed some of the PowerPoint slides, the ones that have some case studies and questions. You can refer to your textbook for those, but I'm going to be going through this relatively quickly, more quickly than I would in a regular class, of course, because we don't have the questions that you would normally be asking. Please, if you do have any questions, feel free to go ahead and email with any questions. But the information that you're going to need for the test from this particular lecture is going to be included in the textbook and on these slides. So just to review, kind of covering some of the stuff that we went over last week, the difference between substance abuse and substance addiction. Substance abuse, when somebody uses either a medication or a substance outside of its normal use. If somebody is taking, for example, a painkiller like an opiate, or is sniffing paint thinner or gasoline in order to get a buzz or a high from that, that would be considered substance abuse. Substance addiction is a term that means that a person has become physically addicted to a medication, and they have to continue to take that medication in order to be able to function normally. And if they stop taking that medication, they go through a period of withdrawal. Depending on the actual medications or the substance that they're using, those withdrawals can be fatal. The 4 C's of addiction. Essentially, addiction is composed of 4 different components. The first is compulsive behavior, which is just that going through the process of preparing and getting and locating the substance. That oftentimes is that period where oftentimes addicts will talk about romancing the drug or romancing the pipe or something like that. Then cravings. Addiction tends to be a chronic relapsing brain disorder. In other words, it is something that is never really fully cured. A person, once they become addicted, they will always have that process of addiction going on in their brain. Once those neural pathways are open, it's hard to shut them back down. And cognitive impairment. Virtually all drugs that people use do cause some level or some form of cognitive impairment. The different classes of medications, the list here that we discuss in class is really, it's not in any sort of a prioritized order here, but by far the most common type of substance abuse would be alcohol. Alcohol, caffeine, and tobacco are the 3 of the highest or the most prevalent of the substances on this particular list. Alcohol and various over-the-counter drugs and prescription drugs really comprise probably the largest category of substances that are abused nowadays. Steroids also fit into this category. So people that are using steroids, steroids can become addictive, even though oftentimes bodybuilders and individuals will take them because they like the physical effect and the muscle bulking capacity that these drugs. They also do have a psychoactive effect and become very addictive in and of themselves. Also now in the DSM-5, we not only have substance abuse, but also we now call it substance abuse and addictive disorders. And of the DSM-5, we understand that compulsive shopping, compulsive internet use, compulsive spending, and compulsive sexual behaviors, and really any kind of behavior that becomes a disruption in a person's life can be considered an addictive behavior. You could probably, for certain individuals, even put things like compulsive comic book reading or something. Anytime that anybody starts to do something and they do it compulsively as a way of avoiding stressors in their life, or as a way of coping with with any number of instances, and it causes dysfunction, that can be considered a compulsive addictive behavior. The process here, and this is important, you'll need to know this, and this may be questions that will come up on your state boards as well. What happens is that in the brain is that dopamine, as we've talked about in the past, dopamine is a substance and a neurotransmitter that causes us to feel a lot of really cool, neat things. When you, anytime that you go to a movie and you have a great time in the movie and it was like, wow, that was really great, and everybody's just really like, kind of, that was the best movie I ever saw, or you're listening to music that you really like, or you go out and you are camping and just having a great time with everybody, and everybody's in that feel-good mood. What's happening from a biological sense is you're getting a certain dose of dopamine that's going on in your brain. Well, what happens is that when a person starts to use substances, and oftentimes substances, particularly opiates and drugs such as ecstasy and a lot of drugs of addiction, they cause this dose of dopamine. And so a person begins to then relate that this drug and this substance becomes related to this increase of dopamine. So therefore, once that cycle starts, when a person makes that connection in the brain, it's hard to turn that off. And then it's kind of like, wow, I'm kind of really feeling bad today. Instead of going and watching a movie or reading a book, I'm going to go and do some opiates or do some drugs or drink a lot of alcohol. That's what causes this cycle to start in the brain. That dopamine is kind of the reward center. Dopamine is that drug that really plays a part here. And so, it's difficult to shut off that cycle of addiction once it starts in a person's brain. For the assessment, it's important to understand how, such things as how long has a person been taking a particular substance, how long have they been using, when was their last use, particularly with alcohol. This is important because when we're assessing people that are addicted or that are at risk for going through withdrawals, we need to know when was the last drug that they took, when was the last drink that they had. That's important because that is going to be our time frame as to when we're going to start looking for withdrawal symptoms. So assessing for withdrawal is really important here. Also assessing for overdose. Quite often people that are addicted and have developed a tolerance to drugs don't realize that they are as impaired or as close to a really poisoning themselves as they really are. Individuals will oftentimes, particularly with heroin and opiates, people will kind of sort of like feel it's like, well, I'm just having a really good high right now. And then they add a little bit of alcohol, add a little bit more drug to it, and they'll end up dying because of the respiratory depression. Want to see what is the person's physiological response. What is going on with them physically, emotionally, and mentally. Identify, does the person want to change? Is the person willing to change? Do they understand that the substance that they're using is going to cause them ultimately to have really negative physical and social and financial and every other kind of effects? So what is their level of motivation, and do they understand the community resources available to them to change their addictive behaviors? Alcoholics Anonymous is a very common, and really all the 12-step programs are set up on the same pattern. These are not treatment programs per se. They are self-help groups. They are run by other people that suffer with addiction, and they're focused on the 12 steps. The 12 steps are a process of a person going through and understanding or coming to a realization that they're trying to quit, or they've tried to quit this addictive behavior and they're unable to. And so moving through the steps, they move through the process of being able to forgive themselves and be able to forgive others with a high spiritual component. Part of it you'll often hear the AA meetings that you've attended. You've heard individuals say that they've turned to or that they have to look to their higher power. That may be God for certain people. For other people, it may be some other spiritual thing. But the idea here is that it's something, an alcoholic or a person that's going through addiction says, I can't do it on my own. I need to have some support system. If I try to do it on my own, I'm going to not be successful. But I can turn it over to a higher power and to my friends to help me with it and get help with that addiction. The beauty of 12-step groups is that they are free, they are community run, they are very prevalent, they're really everywhere. And so it is, and they don't cost anything. So it's actually a very cost effective and overall a very effective way of treating substance abuse issues. When we're talking about substance abuse, it's hard to avoid the topic of what to do with a individual or a nurse or somebody that we know who is using or who has become addicted. This is one of those things that oftentimes people don't really want to talk about it. They don't want to say anything. They don't want to get involved. However, it is really important to realize that individuals that are addicted are a danger not only to themselves, but to the patients that they care for. There's a high level of addiction in all the health professions, but nursing is really close to the top of the list. Nursing, just as a general rule, and emergency room physicians they're the two healthcare-related disciplines that are most highly correlated with substance abuse issues. It's because of the stress that they live under, and it's because of that ability, that closeness, that ability. It's easy to get medications when you're working in the emergency room and when you're nursing and performing in many nursing roles. It's really easy to get those drugs, and so therefore there is a risk. Almost every nurse has some inherent risk of possibly becoming addicted. The problem is that we are oftentimes, just because of the way that we're, ethically, the way we look at our relationships, we don't want to say anything if we do see somebody who is impaired and we know they're impaired. We don't want to say anything because there's this fear about, what am I going to do? What am I going to say? But it is important. It is an ethical responsibility that all nurses have to report nurses that they know are impaired and to take action. You'll see this also when you go to the State Board Disciplinary Review meeting that is going to be on, I believe it is May 14th, I think, in San Diego, that you're going to be attending as a class. You'll see some nurses that have usually they're in various stages of denial and various stages of coming to accept the issues that their addictions have caused. Alternative discipline programs are programs that are not necessarily specific to nursing. However, nurses do have a process where if a nurse basically comes clean and says, look, I've got an addiction issue and I've been stealing medications and I'm using some substance, a nurse can save her license and can go through and essentially get that license saved and not lose their license, not have to go through a disciplinary process. However, they need to come forward before they are actually caught. That's one of the things that is one of the requirements in these, is that a individual needs to come forward, needs to admit that they have a problem before they actually run into some sentinel event or run into some issue in the hospital. It's a little bit of a difference between from state to state as well. In California, a nurse can be caught, and as long as they have not caused any real harm as of yet, even if they don't admit it right away, a nurse can still opt to go on in California we call it the nurse diversion program. However, other states have different rules and different guidelines that they use in these alternative disciplines. The idea is that a nurse that gets help, and really any healthcare worker that gets help and seeks out help, should have a support for that, and that we can save them, we can salvage them, but they have to be willing to receive the treatment. One of the issues that also is important to discuss when we're talking any kind of substance abuse is that usually when you have somebody that is abusing a medication, that's abusing the drug, you usually have somebody who is covering for them. This may be, very typically you have somebody who is an alcoholic who doesn't want to go to work, or they're too drunk to go to work, and so they'll ask their spouse or significant other or friend, can you call in for me? Just call them and tell them I'm sick right now. Because I don't want them to hear my slurred voice right now. So can you call in? And an enabling person, we call it somebody who is codependent, will say, yes, I can do that, but you've really got to stop now. And they'll kind of sort of get into this pattern of kind of helping and enabling that person, never letting them feel the consequences of their actions. And that's an important thing to keep in mind is when we're dealing with individuals with substance abuse, we have to, people need to understand that going through those consequences is an important part of the process. It's an important part of getting better, is going through and taking responsibility. That's a big part of the AA process, is essentially taking responsibility and saying, I'm sorry when I can, and but not putting on anybody else or blaming other people for the problems that come about because of the addiction issue. The CAGE screening tool, these are 4 common questions that are used, and basically it's a very straightforward, very simple screening tool. And like all screening tools, it has inherent limitations. It's not very deep, but it does give an indication that if an individual answers yes to any of these questions, there's an indication that they may be or they may have a substance addiction problem. It was first used with alcohol. However, it has been adapted to include other drugs, and essentially it is just 4 questions. Have you ever felt you ought to cut down on your drinking or drug use? Have people annoyed you by criticizing your drinking? In other words, not just have people criticized you, but have you been annoyed because people have criticized you? That annoyance is important because that hints at defensiveness. If a person is defensive about their drinking, that means that they probably have an issue. Have you ever felt bad or guilty about your drinking or drug use? And have you ever had a drink or used drugs first thing in the morning, also called an eye opener, to steady your nerves or to get rid of a hangover? If you answer yes to any of these questions, it does indicate further assessment there may be an issue with substance abuse. The signs and symptoms. Review in your textbook the signs and symptoms of intoxication, overdose, and withdrawal for the various substances. Just as a general rule, when we are assessing anybody with substance abuse, it's important to get their history. How long have they been using? Do they have any family members that have been using? Have they suffered any consequence as a result of their use? Do they have any medical problems that either led up to or were a precursor for their substance abuse issue? For example, somebody with chronic pain becoming addicted to opiates. Or do they have physical problems such as cirrhosis of the liver, hypertension, and other issues that can come about because of use of medications or drinking? Assessing for violence is important. Is a person suicidal? There's a high correlation of suicidal behavior in individuals that are addicted to substance abuse. Alcohol withdrawal is, of all the withdrawals that people can go through, alcohol is the one that will kill people. So we have to be very careful when we assess individuals to assess if they are, if a person is drinking, if a person comes into the emergency room intoxicated on alcohol, realize that there is a potential danger for withdrawal for those individuals. So that is something that always needs to be kept in mind. The first signs of alcohol withdrawal usually develop within a few hours of a person who has been drinking for a long period of time. Typically, people who are alcoholic will be drinking sometimes all day or multiple times a day, but they will be in a pattern of daily drinking. Oftentimes it starts with blackouts, and usually in the evening or in the afternoon, whenever a person is drinking, they will go through periods of blackouts, which is periods of amnesia where they do, they're alert, but they don't remember things. They don't remember their behaviors. They don't remember what happened. And then in the morning, oftentimes they'll take a drink in the morning, because when they wake up in the morning, they have those shakes, and they have that, sometimes, very intensive tremors and sweating and just a lot of withdrawal symptoms. And so they'll take that drink in the morning to try to ward off any more of those withdrawal symptoms. Usually the signs of alcohol withdrawal usually peak in 24 to 48 hours. However, grand mal seizures can occur up to 2 days after a person stops drinking. That's really the problem that we have with alcohol withdrawal, is alcohol withdrawals will cause a tendency towards seizures, and that's usually why people die. These seizures tend to be very bad, very long-lasting, and can result in death. Oftentimes, people going through alcohol withdrawal will also experience illusions. They'll oftentimes become paranoid. They will sometimes see things. They'll see things crawling on the ground. They'll feel things on their skin and become very agitated. And they'll feel like they're shaking inside. They'll have this feeling of, they'll talk about it like they just feel like a humming or a vibration through their insides when they're going through that alcohol withdrawal. One of the ways that we use to treat alcohol withdrawal is to give IVs. You've all heard of banana bags. You've probably seen banana bags given in the emergency room. A banana bag is essentially a bag of D5 with thiamine, magnesium sulfate, and some multivitamins that is given in an IV. And so that helps to rehydrate the individual. The magnesium sulfate helps to regulate the electrolyte balance. And the big problem with alcohol in particular is thiamine reduction. Thiamine is depleted when people are drinking. And so a lack of B vitamins will cause long-term cognitive effects. And so giving thiamine is very important. Also benzodiazepines, that is a medication that we usually give, usually lorazepam, sometimes diazepam, so that would be Ativan or Valium, or one of the other benzodiazepines, typically known as anti-anxiety medications. We don't give it so much for the anxiety as we are just to keep a person from having seizures and from going into seizures. Anticonvulsants may be used for the same reason. When trying to get a person to go through recovery, the most important things here are to instill a feeling of hope. Oftentimes individuals going through withdrawal feel hopeless. They feel like it's never going to get better. And so it turns into a system of a lot of nihilistic thinking. This is never going to get better. I'm not going to get any better. So I may as well just continue to drink, or I may just continue to abuse because, well, it's never going to get any better anyway. Finding a support system, helping the individual to find other people who have been through addiction and have come out the other end is very important. Also needs to address cultural issues, discuss any trauma that the person has either been a victim of or a perpetrator of, and always based on respect. So that people that are going through addiction, they just feel bad about themselves. They have an incredible amount of guilt, and so being respectful of them and seeing them as a valued person without judgment is very important. Enabling behaviors. This is a really big topic. When we have people that are abusing or have used, like I said, there's somebody that is probably on the other side who has either excused or ignored behavior, never said anything, sometimes has jumped in and covered with somebody so that they don't get in trouble. And they've done something to essentially help that person stay addicted or not go through the consequences, the natural consequences that come to substance addiction. Usually these individuals are oftentimes they're very sensitive to individuals being criticized. So if you do see a situation where one nurse who is clearly impaired and is acting impaired, and you have somebody that jumps up and says, well, wait a minute, I don't like what you're saying about that person. This is just not right. Kind of a big question that you may be talking about somebody who is enabling here. Oftentimes, all these behaviors are very, very subconscious. They're not the sort of things that we normally talk about, or they're oftentimes are not real, on the forefront. They're the sort of things that happen subconsciously. So if anybody is really getting defensive about a friend or a colleague or somebody else's drug use, that is kind of a sign that they may be enabling their behaviors. These are the list of the nursing diagnoses: imbalanced nutrition, ineffective airway, ineffective breathing pattern. The most important ones up here, the first ones we want to address are, well, the ones that we are really important to assess for are risk for suicide. Risk for suicide, hopelessness, and other directed violence would be kind of at the top of the list. However, on the physiologic side, imbalanced nutrition, people that are using drugs and or drinking alcohol usually are not taking in or are not taking very good care of themselves. Of course, breathing cessation ultimately is, particularly with alcohol and also opiate addiction, is that's how people die, is they just stop breathing, or they have seizures and they start breathing. So keeping that breathing pattern and that effective airway is all important. Different medications that we use to treat alcoholism. The list here, Revia or naltrexone, which is really just the same thing as Narcan, is a medication that blocks dopamine receptors and alcohol receptors in the brain, so the person just stops that alcohol craving that people get. Camprol is a medication that helps also stop people from abstaining from alcohol. Topamax is an anticonvulsant medication that we also use in individuals with bipolar disorder, that essentially says here that it decreases the alcohol cravings, and really it decreases and helps and works to kind of break that cycle in the brain that a person has of dopamine / drinking / drugs / I want to use. It helps to break that cycle. Disulfiram or Antabuse is a medication that is given that really is fairly benign. It is a type of an antihistamine that when a person takes it, they do not have any direct effects. However, if they mix alcohol with it, so if a person is taking Antabuse and then they go and they have a drink, they get really, really, really sick. They get physically ill. Patients will talk about it like they have a really bad flu. And so, therefore, Antabuse is a medication that is good as if there's a support person that can supervise a person taking Antabuse. Sometimes that is a way for a person to take a medication that will help to be a little bit of an aversive thing, where a person doesn't feel like they know that they can't use, because if they use, they're going to get really sick. And sometimes that's enough motivation for a person to stop drinking. If a person asks, well, Antabuse really help me with that drinking problem? The possible answers here is yes if you're motivated, yes if you use it correctly. That's totally up to you. Or, well, Antabuse works for some. Really, the correct answer is yes if you use it correctly. Person has to be motivated as well, but if you use it correctly, that can cause it. It can help them to avoid their withdrawal. Sometimes that is the one thing that will really help them with it. We talked about the assessment earlier. Assessing labs is also important. Individuals that are using alcohol typically will have impaired electrolyte balance. They'll be dehydrated. We want to also do a very thorough health assessment to try to identify any other physical issues that a person may have. Typically, when a person is using alcohol or is using drugs, they're physically not in very good condition, so they have usually other physical problems going on as well. For CNS stimulants, these are the signs of abuse is usually dilation of the pupil, dryness of the oral nasal cavity, excessive motor activity. So crack and cocaine, and also caffeine and nicotine fall into this category as well. A lot of times people are kind of surprised when you hear nicotine being a stimulant because, well, especially if you've ever been a smoker or if you know smokers, smokers will often talk about cigarettes relaxing them. And really what cigarettes do is cigarettes are a stimulant that cause addiction. And what happens is when you don't smoke for a while, you become addicted to the nicotine. So that causes anxiety, and that's what causes you to go smoke again. So that having a cigarette to relax is really more of a psychological effect that goes on. And really the nicotine is in itself a stimulant. And continuing to smoke keeps a person from going through withdrawal symptoms. Cocaine and crack are natural ingredients. Sometimes you'll hear drug people talk about them. It's like, well, they can't be that bad because they're natural. They come from the cocoa bush. When smoked, a person gets a very fast effect. Just less than 10 seconds, a person gets high. And so they start to kind of get an immediate effect. And then that peak of the high usually comes after about 5 to 7 minutes. It doesn't take very long for that person to get that feeling of high, and that feeling of a lot of that dopamine activity just gives a feeling of well-being. The problem is that it's a very short-lived thing. It doesn't last very long, and then when the person stops using, it's usually followed by a crash and depression, anxiety, and therefore that is the reason the person wants to continue using is because they want to keep catching that high again. For opiates, the intoxication effects are usually constricted pupils, increased respiration, increased blood pressure. And so the withdrawal effects are on the right side of the slide here. Usually people going through opiate withdrawal, oftentimes people that are addicted to substances will talk about opiate withdrawal being, from a physical point of view, or at least the subjective experience, as being the worst. This is where, like, you hear about heroin withdrawal, and heroin withdrawal being the worst of the withdrawals. The good news about opiate withdrawal, though, is that it is not generally life-threatening. A person is usually going to be able to make it through that opiate withdrawal. However, it does last a long time, and it does cause a lot of physical effects. It can take people weeks before people that have been addicted to opiates, sometimes it can take a minimum of several days and up to 6 weeks before they really work through all of their withdrawal symptoms. Feeling of aches and chills and fever, nausea and vomiting, and just general anxiety are quite often the most prevalent effects of the symptoms that patients going through opioid withdrawal complain about the most. As far as treating opioid addiction, there are a number of medications that we give that do not really help directly so much with the addiction. However, they help the person to make it through and to titrate off the addictive process. Methadone is a synthetic opiate that is really not that much different chemically from heroin. Heroin and morphine and fentanyl, they're all very similar. They're all the similar kind of molecule. They work it the same way. However, some of them are more potent than others. Methadone, however, unlike heroin, is legal. It is dosage regulated. And it keeps a person from going into heroin withdrawal. And so therefore, some people you hear about going into a methadone program. These are individuals who never really want to fully, or for one reason or another, just they're afraid that if they stop using any opiate, they're going to eventually go back to heroin. So methadone is a kind of a compromise that, people go on methadone and go to methadone clinics will take the methadone. However, the agreement with that is that they will no longer then abuse heroin or abuse fentanyl. Uh, Acetaminophen is an alternative to methadone. Naltrexone, again, we're talking Revier here. This is another, again, this is just a narcotic agonist that blocks that dopamine response and therefore kind of makes that feeling of high, or makes that feeling of euphoria that comes along with intoxication. It makes it goes away. Clonidine or Catapres, normally you would think of this as a blood pressure medication. However, it is used as a treatment when combined with the Revia or with an naltrexone, and it does help to reduce those the physical symptoms and that craving that a person has when they're going through opioid withdrawals. And Subutex. Subutex is a medication also that blocks the signs and symptoms of opioid withdrawal. Suboxone is a combination of buprenorphine and naltrexone, and so you kind of get this double whammy. You get a buprenorphine is essentially a medication that kind of mimics an opiate in the brain, so the brain thinks it's getting an opiate, and then you're giving a medication at the same time that's blocking some of those receptors. What that does is it tends to block all the and almost is a cure in a sense for the withdrawal symptoms. The problem is that then the Subutex is something that you have to titrate an individual off of as well. Marijuana, of course, is kind of the big one nowadays because it's legal, and marijuana is everywhere. And a lot of arguments that maybe marijuana should be made legal just like marijuana is. Thing with marijuana, though, is it does not usually cause any kind of real addictive process. There's not too many people that become addicted to marijuana, at least not physically addicted. A lot of individuals use it, and it becomes a substance abuse issue. They abuse it. However, it does not typically cause a lot of ill effects as far as when we talk about withdrawals and needing to go in for substance abuse. I've never seen anybody come into the substance abuse unit with marijuana addiction. It just doesn't happen. People use marijuana, however, it has a relatively low withdrawal profile. People do not generally really withdraw from it. The science is out on it as to how damaging it really is. As a general rule, the prevailing wisdom is it's not as physically destructive to the body as is alcohol. However, that doesn't mean that it's necessarily safe as well. Hallucinogens, these are substances that kind of go in and out of popularity. We tend to see them when they kind of get into the community. We sort of see a lot of individuals that are using these things and come in usually to the emergency room because they have psychosis. These are people using LSD, peyote, psilocybin, also known as the magic mushroom, or PCP or phencyclidine, also known as angel dust or hort trank. PCP is a synthetic form of LSD essentially, and what these are substances that cause a lot of psychotic symptoms. For some individuals, those psychotic symptoms are very pleasant. You hear about somebody having, like an LSD trip. That trip kind of was like, wow, it's like they're leaving their body, and they kind of have this dissociative kind of experience. However, some of these medications, particularly PCP is a medication that can cause severe anxiety, severe panic, severe paranoia, and people don't get over it very readily. It doesn't. When a person uses PCP and they start to have that psychosis and that aggressiveness that comes with it, it can take sometimes a week for it to fully get out of the system, and it has been known to cause some long-lasting psychiatric issues. Inhalants are probably the worst on this list. Inhalants are things like glue or spray paint or gasoline, anything that has a xanthine base to it. So, paint and all of those things. these are medications, or excuse me, these are substances that are usually abused by relatively young individuals because they're very easy to get, they're very easy to find. You know, plastic model glue is something that for years, kids could go and buy, and that's something that if you smell that stuff or if you really inhale the fumes from that, it can make you high, but it can also cause a lot of brain damage. So that's the problem with inhalants, is people that use inhalants don't realize that every time that you use those inhalants, you're causing a certain amount of brain damage. And so you can cause somebody to have stroke level symptoms by using inhalants. But they're popular with a certain segment of the population because they're very cheap. They're easy to get. You can go to the store, you can get them. But they are very dangerous. They will kill you as much as any other drug can. And the club drugs. The club drugs have become more prevalent of lately. Ecstasy is probably the biggest one on this list. Ecstasy, and really all of these, MDA and MDE, are they're very similar in chemical compound. They are similar to a hallucinogen. They have a certain stimulant effect. Very similar to cocaine. Individuals that use them will sometimes even, ecstasy and cocaine are oftentimes referred to interchangeably. They call drug clubs or club drugs because they become very prevalent in the clubs, in the raves, the various parties, and usually come in a pill form. And there's something that are relatively easily hid, and something relatively easily ingested. Date rape drugs. Sometimes you hear them referred to as roofies, rofinol, gamma hydrobutyric acid. These are medications that are really more like an anesthetic. The problem with the date rape drug is they're usually combined with alcohol. They are usually added to somebody's alcoholic drink, usually a high alcohol content drink. And what it does is this medication combined with the alcohol cause a potentiative effect where the person goes through a period of amnesia, kind of like a blackout. And so it's almost like they become very intoxicated very fast. And essentially what they do is they potentiate that alcohol effect. So a person goes into blackout. When a person goes into blackout, their inhibition drops, and they then are at risk for being abused. And that's what these are called, date rape drugs, because these are the drugs that you give to somebody to make them pass out so you can take advantage of them and that you can have your way with them, so to speak. So again, they're not typically a drug of abuse in and of themselves. However, they are, along with the date rape drugs, they are found out there, and they are things that we do test for in the emergency units and in the mental health triage units. So always when we're talking about anybody with any kind of withdrawal, we always want to assess for withdrawal syndrome, understand what the signs and symptoms of withdrawals are for those different types of substances. Always suicidal thoughts, and assessing for suicide is very top priority at the top of this list. Help the person to understand what their resources are, evaluate them for any physical complications related to their drug abuse. Also want to assess them to make sure that while they've been under the influence of drugs, that they haven't been a harm to themselves or to somebody else. And try to motivate them to, or we look to motivate them to, or try to assess their motivation at least, to try to help them to look to other alternatives other than their drug of choice. Alcohol withdrawal versus alcohol with delirium is important. Alcohol withdrawal is something that is, it is something that happens, it's a medical emergency, it's an urgent condition. Usually peaks 24 to 48 hours after a person stops drinking. It usually goes away on its own unless a person starts to progress to delirium. The big problem with alcohol withdrawal, remember, is grand mal seizures, and avoiding seizures is very important. Alcohol delirium is a medical emergency, and this is when a person typically has gone through a binge drink, or they've been drinking a large amount of alcohol over a somewhat extended period of time, maybe 4 or 5 days, and that delirium can start to will start to express itself as a person becoming delusional, usually paranoid, oftentimes very agitated, and you hear it referred to as the DTs. That stands for delirium tremens. Alcohol withdrawal is the same thing, or alcohol delirium and delirium tremens are the same thing. It's alcohol withdrawal where a person has started to have these cognitive and these psychiatric effects. So they become very delusional, very paranoid, and it's a sign that a person is in danger of having brain damage. A person develops something called Korsakoff syndrome, or Korsakoff psychosis, and Wernicke's encephalopathy. Wernicke's, Korsakoff's is essentially the brain damage that comes about from too much alcohol, or when a person has been using a lot of alcohol and has gone through withdrawal many times. It's the brain damage that occurs from that. Preventing relapse is all important. When we understand that a person has become addicted, we want to keep them from becoming re-addicted, or keep them from going through relapse. So usually this is something that is done oftentimes through group therapy. This is where Alcoholics Anonymous for alcoholics, or other 12-step, either cocaine or Narcotics Anonymous, is an example of the type of support group that will help. However, sometimes those programs in and of themselves are not enough, and so a person will have to check themselves into a rehabilitation program. And a rehabilitation program provides cognitive behavioral training, or cognitive behavioral therapy. This is where a person helps to understand the process of addiction, helps them to understand the reasons that they're using, the reasons they become addicted, and alternative methods for coping. And the main thing here is we want to encourage a person to continue to get help, help, and help them to find ways, or provide resources for them to stay off their drug of choice and to not be addicted. So that's a pretty quick review. I've gone about almost 50 minutes already. Again, some of this content will be on your final exam. I will be also posting a video review for your final exam. That will come sometime next week. I will also be posting for you exactly when your final exam and when your HESI-TAM exam is going to be. It is going to be on March 20th. I just have to verify the time of day that's going to be. Now, that's going to be Tuesday. It's not going to be, I think I'm saying the date right. It's not going to be Thursday. It's going to be on Tuesday. So Tuesday the 20th is the day for the final exam. I will let you know the time. Let me know if you have any questions, and I hope this was helpful.